Hi,
Hi, Emily. How are you today?
I'm good. How are you?
I'm just fine. Well, welcome to the interview. Um,
Thank you.
I'm just going to go through a few questions with you and then we'll move on, okay?
Okay, sounds good.
So, Emily, tell me a little bit about yourself.
So I graduated nursing school from Worcester State University at in May 2019. So I obtained my BSN from them. From there, while I was in nursing school, I worked as an emergency room tech at Sturdy Memorial Hospital. Once I graduated, I went to Newton Wellesley to work as a nurse. I completed their newly licensed RN graduate program. I was originally on an orthosurgery unit, and then the program itself was 3 months long, so once I completed it, I stayed on that unit until I accepted a permanent position. Um, in March 2020, COVID happened, so that unit was actually converted to a COVID ICU, so I did that for a while, and then, in, I think, May or June of 2020, I accepted a position on a general surgery unit that had 9 different specialties. They had, like, GI, GYN, urology, ENT, um, some spinal surgeries as well. So I got a lot of experience from that, and I stayed there until January of this year, actually. Um, at and in January of 2021, I started working at UMass Memorial on a GYN oncology and surgery floor because I realized that GYN was really one of my interests. So then, actually, I started working there to get more experience as I complete my women's health nurse practitioner degree. And then in November, actually, of 2021, I started travel nursing to get some more experience. And then I recently left that job and I'm actually starting at Boston Children's Hospital on a transplant unit and complex surgery unit in August.
Very good. So, what made you choose this career track to be a nurse?
So I originally became a nurse because my brother growing up had some hip problems. He had numerous surgeries at Boston Children's Hospital. So that really started my interest in nursing, and it's been my goal to work there ever since. I was like 12 years old, actually. And then I decided to become a women's health nurse practitioner after my own personal struggle with advanced endometriosis. I learned that even in 2022, women's healthcare in America is really not a priority and it's further behind than it should be. In terms of like the maternal mortality rate in America is worse than any other developed nation, and there's just a lot of issues with women getting access. Like the teenage pregnancy rates in America are higher than other countries, so it just really motivated me to try to make a difference.
Very good. Well, tell me about some of your strengths.
So my strengths are definitely being well organized. I'm a strong communicator. I'm very good at like my documentation and like I have a lot of experience with Epic, so documentation's never been an issue for me. Um, I'm definitely a team player. I'm always asking people if they need help with anything or if I can assist them in any way. I'm always precepting new graduates and nursing students as well. So I would say those are pretty much my main strengths.
How about some of your weaknesses?
So some of my weaknesses, I'm horrible at asking for help. I'll get overwhelmed, um, and just let myself drown until like without asking for help. It's very difficult for me to ask for my assistance from my colleagues, even though I know they're willing to help. It's just I feel bad asking them to take on some of my work, even though I'm always willing to help them. And I know they would have no issue at all helping me.
Mhm. Very good. Well, tell me why you want to work here.
So I'm applying for a women's health nurse practitioner position. As I mentioned, I I've been interested in women's health for a while, so I'm pursuing this job as my first nurse practitioner job. Since you guys have a lot, you offer a lot of community services to women, offering like birth control options and cancer screenings to low-income women. I think that's very important. I've also heard from several other nurse practitioners that this is an excellent place to work. They all love it. There's a lot of support for new grads, and I precepted here, so it's definitely I've seen firsthand how great all the staff is and management and everything, so I would definitely love to be part of this team, and I already have some introduction to it because I precepted here and completed clinical hours, so I think I'd be a good
Mhm.
fit.
Okay. Well, tell me where you would like to be 3 years from now.
So in 3 years, I have a couple of different interests, so I definitely want to establish a foundation in general OBGYN care, primary care of women, and then I wanna kind of either pursue more of, like, a surgical specialty, like endometriosis treatment or reproductive endocrinology I'm very interested in as well. Um, so I need more experience before I decide, like, what I would like to pursue further. I have always been interested in, like, the OR and being, like, a first assistant, so that's potentially something I would like to pursue. I'm also interested in maybe getting my midwife certificate. Um, it just depends. I need more experience before I can really decide. Another area I'm interested in is maybe potentially owning my own practice or opening my own practice, but I definitely need more experience before I move forward.
Well, well, Emily, those are the final questions I have for you. Thank you for your time. And we will be getting in touch with you soon, okay?
Perfect. Thank you so much. Is there
You're welcome.
anything else I need to do as far as next steps?
Well, first of all, do you have any questions for me?
Um, so I had a question regarding like how long an orientation is.
Okay, so orientation will be 6 weeks.
Okay. With like one-to-one with another women's health nurse practitioner.
Yes, you would be assigned with someone who has a few years of experience as a nurse practitioner under her belt. And then, so 6 weeks is the tentative time frame, but it's also depends on, how you feel about you being on your own.
Okay. Sounds good.
Okay. All right. Any other questions?
So as far as next steps, what would if you were to move
Well,
forward with employing me?
so we will complete our interviewing process and then we'll be calling our candidates and bringing in, we may have a second phase interview or we may not. So, but you should be hearing from us within a week.
Okay, sounds good.
Okay.
Thank you so
All right.
much.
You're welcome. It's very nice meeting you. Have a wonderful day.
It's very nice to meet you too. Take care.
You too. Thanks.